Hi, everyone. Thank you for joining us today. This is a training webinar for NASTAD's plan comparison tool, prepcost.org. My name is Dori Malazanov. I work on the health systems integration team here at NASTAD. My colleague Edwin Corbin Gutierrez, also from the health systems integration team, will be joining us today as well. Just a couple of things. This webinar is going to be recorded. In terms of questions, we'll have some time for Q&A at the end. We ask that you please utilize the chat function to send your questions as they come up. And then at the end of the presentation, we'll look through the questions that have come in or new questions that come in during the Q&A and answer them. So we're going to use the chat box to facilitate the Q&A. Everyone should be muted. We ask that you please keep yourself muted and also that you don't put us on hold if you have another call. It's best for you to leave the webinar if you have to and come back in than to put us on hold, or else we'll all hear your music. And with that, we can get started.
Thanks. Thank you, Dori. So this is what we are going to cover today. We are going to talk about what prepcost.org is, how to use it, how to enter client information, sort plans, look at plan information and costs. We are, and then finally enroll in a health plan. And then we should have some time for questions at the end, like Dori mentioned. Feel free to do the chat box for questions. If you would like a refresher on the key health insurance terms that we're going to cover, watch the recording of the webinar overview of marketplace plans at nastad.org/prepcost. And hopefully everyone is also registered for our webinar on Monday, which will do a little bit of a deeper dive, followed by case studies and live site demonstrations. Finally, we put together a new user handbook for prepcost.org. You can download it from our resources page and follow along. And we just posted the links to all three, to the two webinars and the user guide.
Thanks. So to be clear, in the chat box I've sent out, and I can also send it via email to anyone who needs it, a link to a webinar recording from last year that provides an overview of some of the health insurance basics that we're not going to get into too much detail on today, but that we'll talk about a little bit. There's also a link for our Monday webinar for registration and a link to our new PrepCost user guide that's in the chat.
So PrepCost is a health insurance assessment tool for individual marketplace plans in all 50 states and DC. It calculates total annual PrEP costs, including monthly premiums and out-of-pocket costs, and can estimate a client's eligibility for marketplace financial assistance, including premium tax credits. It also factors in the manufacturer's copay assistance program into these calculations. And starting in 2020 open enrollment, users will be able to view formulary coverage for Truvada as well as Descovy. These are the two medications currently approved for PrEP. The primary audience for the site is support staff at clinical and non-clinical agencies that provide PrEP navigation, case managers, and also HIV prevention services. The site boils down a lot of health insurance information down to the variables that impact the cost of PrEP care. And it's going to be helpful for staff that don't have that health insurance expertise but want to provide these services. And the site also can be helpful for health insurance assisters and benefits coordinators that have that expertise, that insurance know-how, but not the PrEP specific cost information and financial assistance and resources. It's most helpful for clients for whom PrEP is their primary anticipated health expense. It can also be used as a tool for educating staff about plan options or looking up specific plan information. The site is intended as a way to engage patients whose primary anticipated PrEP care, who need to have basic conversations on the cost of care for PrEP. The site is designed to help them compare best coverage options, and primarily for marketplace plans. And we have partnered with Consumers Checkbook for the development of the site. with Vericred to provide the health plan data, and Health Sherpa is our enrollment assistance partner for the project. PrEPcost.org can be helpful in a number of ways. In addition to aiding plan navigation by providing built-in cost calculations for PrEP care, it can also be a resource for educating about all these plan options and the financial assistance pieces and specific plan information. So let's take a closer look at the site. We are excited to announce that the version of the site that we are about to show you is going to be available to preview plans in some states starting on Monday. So that's before open enrollment begins, but the preview mode will be available in states that have at least 85% of insurance carrier data completed. So the site will be available for at least 27 states starting on Monday, and we will continue to add states throughout the week, and we expect the national launch to take place in early November.
Thanks, Edwin. So now I'm going to talk a little bit about how we use the site. So using PrEPcost.org is easy. It's basically a four-step process. First, you provide basic information about the client, such as zip code, age, income, and other things that are listed here. The site then searches the health plans that are available in your area and sorts them based on the total cost of PrEP to the client. At this point, you would be talking through some of the costs and other information on the page with the client and helping them to identify some plan features that they're looking for. So for example, they're looking for lower monthly costs and they're okay with a higher deductible, etc. Just identifying some preferences for what they're looking for. Third, once you've identified some plans that might be of interest to the client based on what they're looking for, you look at them more closely, do a side-by-side comparison perhaps. And then once the client has chosen a plan, you connect them to enrollment experts at Health Sherpa who will help them apply for coverage and enroll in the plan of their choice. And this can be done on the phone in your office during the same visit through a dedicated phone line for PrEPcost.org users that we'll talk about a little bit later. So I'm just going to go through some of the information that we asked for and some screenshots of the site. And then if you all tune in on Monday, we'll do a live demonstration of how the site works and some case studies. But for now, I'll also show some static images just to show how the site is laid out. So the first page after the landing page is the client information page. This is where you enter various pieces of information about the client. Most of the information is pretty basic. You entered their zip code, you select the right county from the drop-down menu. This is important because the zip code determines which plans are available to someone because it's based on geography. Then you need to enter the client's age because plan costs vary depending on someone's age. Younger clients will have lower premiums for the same plans, referred to as age rating. Indicating yes for tobacco use can result in significantly increased premiums. So now this is where things start to get a little more challenging because now we get into the questions that clients don't necessarily know off the top of their heads. Tax filing status, availability of comprehensive coverage through their job, which you'd think everyone would maybe know, but actually it's not everyone, but a surprising number of people don't necessarily know whether their job offers coverage or whether it offers comprehensive coverage. And also income. Next, you need to know if they file taxes on their own or if they file with a partner. This is helpful for the tool to calculate financial assistance as accurately as possible. Next, you want to know if the client has insurance through their job or their partner's job. People with comprehensive coverage through a job usually can't get financial assistance for a marketplace plan. That's true even if they opt out of the employer plan or it's really expensive. But they can still use the tool to browse plans at full cost and enroll if that's the best option for them. Next, you want to choose either Truvada or Descovy. A new feature this year is that the site allows you to pick one of the two medications and see plan costs and coverage for either one. You can't see them both at the same time, but you can choose one and then the other if you like. But as some of you may know in previous years, our tool only showed costs for one drug, which was Truvada.
Brief note there are now 2 medications approved for PrEP by the US Food and Drug Administration. Truvada was approved for PrEP in 2012, and a generic version of a generic TDF FTC version will be available starting in September 2020, and we expect many health plans will begin covering this option soon after it comes online. And then Descovy was approved, the TAP-based regimen was approved for PrEP in October of this year for at-risk adults and adolescents. And notably, Descovy is not indicated for individuals at risk of HIV infection from receptive vaginal sex, because the effectiveness in this population has not been evaluated. NESTED recently looked at more than 8,800 2019 marketplace plans to see if Descovy was covered, and found that more than 99% of these plans already cover Descovy, since it was approved for treatment, and no additional approval on a formulary is needed for PrEP. More than 99.9% of these plans also cover Truvada. The drug tier for each medication might be different within the same plan. So even if the 2 drugs are covered, they might be on different tiers. And a higher tier may lead not only to higher out-of-pocket expenses, but also trigger prior authorization or other utilization management strategies.
Thanks, Edwin. So jumping back here to the prepcost.org client information page. So after you've entered all the other information that I've talked about, you need to enter the client's income, an estimate of their income. So if the client doesn't know their income, or their income is really high and they know they won't be eligible for marketplace assistance, or they just don't want to enter it, they can still look at full cost plans by choosing I prefer not to enter income at the bottom. But if the client wants to see an estimate of how much financial assistance they're eligible for, an accurate income estimate will be important. I just wanted to pause here and highlight that it's really, really important for clients to bring documentation of their income as much as they can for an enrollment appointment. Ideally, clients who come to your agency who've scheduled an enrollment appointment for a future date will be reminded by whomever staff they're working with in advance to bring documentation with them. They should bring a recent tax return, some pay stubs, documentation of self-employment income. There are many options. This is because clients often don't know their exact income off the top of their heads, especially if they have multiple income sources, or they do seasonal work, or they're self-employed. They can still use the site if they don't know their exact income, but it'll be a lot more helpful if they can estimate it as accurately as possible. Also, they'll need to document their income accurately if they eventually move on to complete enrollment through Health Sherpa or the marketplace. And it's always best to do everything in one sitting so you don't risk clients falling through the cracks. If someone doesn't bring their documentation and then they have to schedule a second appointment to come finish their enrollment, you know, I really can't stress enough how important it is to try to avoid this if possible, because you know, we know that having to come back again a second time often results in attrition, and people just never come back. So ideally, any staff doing enrollment with clients should be aware of the documentation that's needed. For prepcost.org, it's just income documentation, but for actual enrollment, you also might need immigration-related documentation, social security number. So staff doing enrollment should know all these requirements and should work with clients to ensure that they come prepared.
The manufacturer of the 2 drugs approved for PrEP, offers a copay assistance program for all patients with private healthcare coverage, and PrEP cost includes this assistance, the copay assistance card, in our estimates of cost. The program covers PrEP patients regardless of income, and it covers all of the out-of-pocket costs related to the medication. This includes medication-related deductibles and copays, and in most cases, it can cover all of the costs associated with the medication. The maximum amount covered by the program is $7,200 per year, and for 2020 plans, the maximum out-of-pocket allowed is $8,200. So the copay assistance card will cover all drug-related costs in the majority of plans. The other national copay programs may also be available for PrEP, but may close periodically based on funding. More information about these plans is also available in our resources page. And the manufacturer's copay assistance program is going to be available for both Descovy and Truvada in the same way.
Thanks, Edwin. So jumping back now to estimating income. So once you put in a consumer's income, if their income makes them eligible for Medicaid in their state, they're going to get a pop-up window that looks like this, letting them know that they might be eligible for Medicaid. It'll have a number to call Health Sherpa to apply for Medicaid. If they have the option to proceed, or they have the option to proceed and just look at full cost plans. If you're eligible for Medicaid, you're usually not also eligible for marketplace financial assistance. So if you are eligible for Medicaid, in most cases, you would have to, and you still want a marketplace plan, you would likely need to buy one at full cost, which was not really an option probably for most people that have Medicaid level income. So some shortcomings with our tool to know about. Our tool does not screen at all for Medicaid eligibility. We didn't ask any questions, as you noticed in the client information page, about things like disability, pregnancy, etc. These are other ways people can be eligible for Medicaid. We do not look for them on our site. This message that you see here on the screen is only going to come up if someone has income within 138% of the poverty level and they live in a Medicaid expansion state. Those are the only people that are captured by this. It's okay because the folks at Health Sherpa can help determine whether someone's actually eligible for Medicaid. They have the ability to do not only a better screening, but a proper application and eligibility determination. If someone's income is too low for marketplace assistance, but their state has an expanded Medicaid, then they're in what's called the Medicaid gap. Hopefully this term is familiar to folks here. They'll get a message that looks similar to this, but it'll let them know that their state might have options for uninsured clients, and it'll direct them to Health Sherpa and to other resources to learn more. And also, like I said, this tool doesn't screen for Medicaid eligibility on the basis of things like disability, pregnancy, etc., but Health Sherpa can do that. So, and then finally, another note about working with low-income immigrants. If you're working with a low-income immigrant and you get either of the two Medicaid eligibility messages, this one or the other one for the non-expansion states that I mentioned, it's definitely best to call Health Sherpa. Eligibility for Medicaid and marketplace coverage is pretty nuanced and a little complicated for a lot of immigrants, and our site does not have the capacity to take all of that into account. A lot of low-income immigrants can actually get extremely affordable private coverage, even if they're within the Medicaid cutoff, the Medicaid thresholds. It's just a strange loophole in the ACA. So Health Sherpa is fully prepared to help clients determine eligibility. So the bottom lines there, the key takeaways are, if you're working with someone who is low income and their income is, kind of under 200% or close to Medicaid, it's always good to call Health Sherpa and just verify what they might be eligible for, because there's just so many things that go into Medicaid eligibility and financial assistance eligibility, immigration, disability, pregnancy, like all these factors that we just can't account for. So for low-income folks, it's best to get an official kind of determination through Health Sherpa to ensure that you're not missing any potential opportunities for getting coverage.
Thank you, Dory. Once you enter all the client's information, you will view the plans, the results in your area. So let's dive in. The tool is going to sort the plans based on the annual out-of-pocket cost for PrEP expenses plus the 12 monthly premiums. The total annual cost isn't actually displayed on the page itself, but the calculation is still being done on the back end so that plans can be sorted accordingly. The plan at the top will be the one with the lowest total annual costs. And when calculating the cost, PrEPcost.org searches each plan's formulary. First, it confirms the coverage of Truvada or Descovy based on what you selected. Then it figures out how much the drug costs based on where it is on the formulary. The drug's tier impacts how much the patient will pay out of pocket for filling a prescription. Then additionally, the tool figures out how much it will cost to have quarterly clinical visits and the labs based on the plan design. So that includes taking into account deductibles, copays, and coinsurance. And all of these costs are going to be different by plan, but our algorithm is able to parse that out to come up with what those costs are going to be for the patient. Remember that the annual costs have also been adjusted to account for the Gilead Copay Assistance Program. And as we mentioned on the premium side, the advanced tax credits are also taken into account in this overall cost. Then people who enroll through the marketplace may be eligible for the monthly discounted monthly premiums in the form of APTCs or advanced premium tax credits. And this is a credit that can lower your monthly insurance premium. It's available as soon as your coverage starts. You can take it in advance as in the form of reduced monthly premium payments, or you can wait until you file taxes and claim the credit then to reduce your taxes, or you can do some of both. The amount you can get is based on your estimated household income for the year, which is why accurately estimating that income is so important, and it really impacts the cost of clients we'll see on the page. These can be used with any marketplace plan except for catastrophic plans, but they're available for bronze, silver, gold, and platinum plans. And also keep in mind that APTCs only apply to marketplace plans. So consumers who need to go off marketplace for any reason are not going to be able to receive these tax credits. In addition to premiums, the site also estimates PrEP out-of-pocket expenses. So an out-of-pocket cost is the amount that the patient is going to pay when they receive a service. PrEP and PrEP-related care generally requires 3 types of services: the prescription, the quarterly clinical visits, and the quarterly lab tests. So there are some months in which you will need all 3 services, but for most months, it'll just be filling the prescription. So for PrEP, the estimated total cost includes 12 months of Truvada or Descovy, 4 provider visits, and 4 sets of lab tests, as indicated in the U.S. Public Health Service clinical guidelines for PrEP. Next, actually, Dory, you.
Yeah, thanks, Edwin. So now I'm going to talk briefly about deductibles, a fun topic for everyone. Hopefully you've all had a chance to watch the pre-recorded portion of the training from last year, which explained deductibles in detail. If you haven't seen it, I definitely encourage you to, if this is a topic that you want to learn more about. We had a really great presenter last year who made some awesome visuals. We got good feedback on it, that it was really helpful to folks. So if you're looking for yourself or for your staff for a really good visual training, visual representation of how this works, I encourage you to check out last year's training. But I'll talk about it a little bit today. Anyway, so many plans have a deductible. It's an amount that you have to pay for services before your insurance plan starts to pick up some or all of the cost. In this way, it's similar to a car insurance deductible. So before the deductible is met, a patient will pay the full negotiated rate for their services. That's the amount that a provider has agreed to accept as payment for a service. It's typically, if not always, lower than you'd pay if you went to the same provider without any insurance at all. So providers, in exchange for being part of an insurance company's network, they basically agree to take a lower fee for their services. So when someone says you pay full cost pre-deductible, what it really means is you're paying that lower negotiated rate. Once the patient reaches the deductible, the insurance company starts to pay for a portion of the cost, and the patient only has to pay a copay, which is a fixed dollar amount, or a coinsurance, which is a percentage. Plans with lower premiums usually have higher deductibles and vice versa. So choosing a plan usually comes down to a trade-off. Does the client want to reduce their monthly costs, but pay more when they receive services and have more exposure to risk in the case of some extreme medical emergency? Or does the client prefer to reduce their point of service costs reduce their exposure to liability, financial liability if they have an unforeseen emergency, and in exchange pay a higher monthly premium. The decision usually turns on considerations that are unique to the client. There's really no right answer to which is better. A client's monthly budget, how many services they think they're going to be using, and also their level of risk aversion all play into this decision. There are some exceptions to deductibles. Preventive services are always provided at no cost to the patient, regardless of whether they've met their deductible. Effective in 2021, this will include Truvada and Truvada or Descovy for PrEP. Some plans also allow the patients to have 1 to 3 primary care visits without having to worry about their deductible. So they might have these visits for free or at a discount. And depending on the plan, some services may be exempt from the deductible. This means the patient pays either a copay or nothing for the service, even if they haven't met their deductible yet. So if they go on January 1, for example, like a primary care visit that's here is $0. It's pre-deductible. Deductible doesn't apply to this. So of course you get 1 preventive care visit for free anyway. But even if you haven't met the $6,500 deductible on this plan, if you go to your primary care provider, you will still pay $0 no matter what. Somewhere in the summary benefits and coverage, it will indicate which services are treated this way. Typically, higher metal level plans will have smaller deductibles because they have higher premiums, and they'll also have more services that aren't subject to a deductible, but this varies a lot by geography. Clearly here you can see that there's a bronze plan that has a $0 copay for primary care. So once the deductible is met, the patient and the plan split costs for most services. Some services have a copay, which is a fixed dollar amount. Other services have a coinsurance, which is a percentage of the negotiated rate. Patients typically prefer copays, and so do we. They're predictable. You know exactly how much you're going to pay for something. With a coinsurance, you can really only accurately estimate costs if you know the negotiated rate in advance, which is not at all transparent. Coinsurance usually results in higher costs than copays, which is usually true for Truvada and Descovy as well. So the patient pays copays and coinsurance for their services until they reach a second threshold, which is the out-of-pocket maximum. This is a cap on how much they can be required to pay out of their pocket for the year, not including premiums, but all the out-of-pocket costs and the deductible, etc. So if a plan has, let's say, a $2,000 out-of-pocket maximum, this one here, the example has $8,150, it's very high. Once the client has paid that amount out of their pocket for services during the year, they don't have to pay for anything at all anymore. So a plan with a lower out-of-pocket max, like $2,000, for example, could be met pretty early in the year sometimes, and then the client has no cost for the rest of the year except for their premiums. That always has to get paid if you want to keep your insurance. And the premiums don't count towards this out-of-pocket max. The site also shows coverage for coverage and costs for PrEP under each plan. It does this by searching the plan formulary for Truvada or Descovy. First, it confirms the drug is covered. Then it figures out how much the drug costs based on where it is on the formulary. Health plan formularies typically divide the drugs they cover into several tiers, with higher specialty tiers being associated with higher out-of-pocket costs. We have published a report finding that Truvada was placed on the specialty tier in 75% of plans on the federally facilitated marketplace in some states. This report is available for download through our resources page. It's called Discriminatory Plan Design. And drugs that are placed on a specialty tier and a plan's formulary are more likely to have more restrictions and to have higher costs. Prior authorization is another thing to talk to consumers about and to be aware of. Some plans might require prior authorization for PrEP. This is a common practice, but keep an eye out for plans that might be using prior authorization as an unacceptable barrier to coverage. Plans can use this for utilization management, but they cannot use it to intentionally prevent people from getting the care that they need. Copay accumulator policies. This is something that we've started to hear about. It's unclear at this time how widespread these policies are. NASAD is certainly watching this issue closely. Plans that adopt this policy may refuse to count the Gilead copay assistance or other third-party copay assistance towards the deductible and out-of-pocket maximum. It's a lot more common in employer plans, but we've started to see it come up in the individual market too. We've identified a number of plans that with copay accumulator policies, and we've updated our site accordingly with this red Truvada copay assistance is restricted message here. We also adjust the cost calculations accordingly when we know about a copay accumulator policy. However, we only know about these when they're reported to us. We don't have the capacity to monitor every plan in the entire country for this. So it's important to verify with the plans in your area whether they're going to count copay assistance for PrEP towards the plan deductible and out-of-pocket max. And if you hear about this happening with a plan in your area, please let us know. If you want information about how to find information about, if you want help with how to find information about this, you can reach out separately and we can talk to you about that. Now just to highlight a few other cool features of the site. The main feature that is unique to prepcost.org that you won't find on other plan comparison sites is the monthly and annual cost calculations for PrEP. So based on the information that you provided on the first page, on the client information page, the site is going to estimate how much you'll pay for PrEP over 1 year. So this includes everything we've been talking about so far. The site does all of that math. It takes into account the deductible, the out-of-pocket max, the co-pays, the co-insurance, all of the 12 monthly premiums, the tax credits, all of those things are calculated and the annual into the annual cost. The annual cost consists of 12 monthly premiums, less tax credits, and then the out-of-pocket expenses for 12 months of PrEP. So that's 12 monthly prescriptions, 4 lab visits, and 4 medical provider visits. The site makes adjustments for estimated tax credits and also for Gilead copay assistance, and then it sorts plans based on the total cost for the year. Or you can sort by plan name or just by the premium. There are also a number of filters that you can use to look for plans that fit your client's needs. Pretty straightforward filtering system here. Cool. Yeah.
So once you've reviewed the plans, you can look at some plan details. So for each plan, you'll be able to take a closer look and compare. We show health plan information summary, the premium, estimated expenses, the deductible and out-of-pocket maximum. And then this page also includes some new information, the network coverage. It includes a link to the summary of benefits and coverage and the plan ID. And this is going to be particularly helpful for enrollment. So if you're not doing the enrollment right away, this is the details page is what you want to print and give to the patient so that they have this information and they're able to take it to their enrollment assister. And then it also includes information about the manufacturer's copay assistance used, just so you know. You'll see the link to the details page. And here you can see the information I just mentioned, the link, the ID for the plan, the type of plan, the manufacturer assistance used. Further down the plan's detail page, you can see the month-by-month breakdown of the cost for PrEP under the plan. The breakdown will be particularly helpful in identifying a spike in cost at any point during the year. So this can happen if a plan has a deductible that is higher than the assistance available for the patient, and then knowing about these costs is going to be important in letting the PrEP navigator know that the patient will probably need additional assistance if they enroll in this particular plan. So in this example, you can see that in May and June, the copay assistance from the manufacturer ran out, and in order to cover these drug costs, the patient might want to get additional assistance. So this is going to be important for them. In developing the site, we had to make some cost assumptions, and for the labs, for medical visits, and this is basically what we used, what we based our estimates in. It's a national average, as Dory mentioned, and we it may not exactly reflect all of the costs experienced by your clients. So please keep that in mind. We're using the wholesale acquisition cost price for the medication as well. Our estimates are also very conservative. We took into account only the lab tests required for all PrEP patients, and we assumed that the provider would reduce costs by billing some of the initial tests as a preventive service. We also assumed that providers would be in network and that the patient would see a primary care provider. So cost for specialists might be a little bit higher. And a full breakdown of our cost assumptions is available on the user handbook. A number of services related to PrEP should be available as a preventive service at no cost to the patient. As we just mentioned, ACA mandates that private insurance plans and Medicaid expansion programs cover preventive services that have grade A or B from the US Preventive Services Task Force, and these are covered at no cost to the patient. So PrEP-related services in this category already include intensive STD prevention, behavioral counseling, screening for HIV, syphilis, hepatitis B and C, and screening for gonorrhea and chlamydia for all younger women and women at increased risk. So these services should already be covered as preventive and should not incur any cost to the patient. And then earlier this year, the USPSTF gave PrEP a grade A recommendation. So it will be covered at no cost to the patient. But that's only gonna start in January 2021. So for 2020 plans, these out-of-pocket costs are still gonna be an important consideration. Plans in New York may begin implementing the recommendation early based on a recommendation from the state's insurance commissioner. So once your client has found a plan that they like and they're ready to enroll, we provide some useful information about Health Sherpa, our partner, so that clients can work with a licensed and certified agent to apply for coverage, get an eligibility determination for Medicaid or marketplace coverage, including eligibility for premium tax credits, get individualized insurance navigation support, and enroll in a plan. And Health Sherpa has created a dedicated line exclusively for PrEPcost.org clients, and we have shared a lot of information with them and some training on the costs related to PrEP, so they'll be able to assist PrEPcost.org users. I don't think, yeah, is there, here's the information.
Oh, yeah. So here, when you don't have to save this number or anything because it's easily accessible on our site. But like Edwin said, we're working with this team of licensed agents to help your clients enroll and pick the best plan for them. And that is the end of our training portion. So we only got a couple of questions, but we have 5 minutes. So if anyone has additional questions, please share them now. And see more coming in. So I will start to go through them, and then hopefully folks will share some more with us. Edwin, the first one is for you. What are the lab tests that are included in our assumptions?
So we included the required or recommended lab tests for all patients. So any test that is specific to a patient based on risk is not included. It's a pretty conservative estimate of these costs, but by providing the month-to-month costs and a breakdown of those, we're hoping that it'll be easier for PrEP navigators and other providers to be able to add or subtract costs based on kind of how their local costs compare to the national average that we used. A full breakdown of every the cost of every set of tests that we use for the tool is available in the guide. So if you want to see exactly what math we used, you can look at that on the guide.
Thanks, Edwin. We had another question here about the USPSTF recommendation. Although starting in 2021, is it correct to assume that PrEPcost.org will not be needed because there simply will be no cost sharing for insured folks on PrEP? I think I might actually have misspoken during the webinar and indicated that all PrEP medications would be covered with no cost sharing. This will be true for Truvada and for TDF FTC when it's generic, but it might not be true for Descovy, at least not in every case. So without promising what a PrEPcost.org will look like next year, the need for helping clients figure out how much PrEP will cost them does not go away necessarily in 2021 for everyone. Additionally, like labs and provider visits are at this point not included as no cost sharing preventives. Well, unclear whether they will be included as no cost sharing preventive services too. So even folks on Truvada will still need to potentially pay for their labs and provider visits. Although of course, the drug being covered with no cost sharing eliminates the most significant expense.
So NASDAQ and our partners are advocating for the clinical visits and labs to be included as part of the recommendation. We are advocating for sub-regulatory guidance on this and at the state level with insurance commissioners. It has not been, the final word on it is not out. So we will keep everyone posted. That's a great question. Thank you.
We have time for maybe one more, and then let's see. This is a really good question. Is the site appropriate for use by ACA certified application counselors to assist patients? Yes, definitely. Actually, I think that CACs, being a CAC myself, maybe I'm a little biased, but I actually think that CACs are great people to use this site because you're really knowledgeable, especially knowledgeable about enrollment, and are able to kind of troubleshoot maybe some of the gaps between our site and the marketplace website. And I think that actually CACs are a great audience for this site. So thank you for that question. And then another question about the generic, about the preventive care. First, starting in 2021, again, PrEP medication will be covered without cost sharing if it's Truvada or for the TDF FTC generic. Not necessarily the case for Descovy, and not necessarily going to be the case for other care ancillary services like providers, visits, and labs. Do we have a list of alternative financial support programs for patients? Yes, we definitely do. You can find that on our resources page, which is linked in the slides and also in the chat box. We sent it out. And I think that, it's 12 o'clock now, so there's a couple questions left here, which we will get in touch with folks to address them. They're a little more individual. So with that, feel free to reach out to us, either Edwin or myself, if you have any other additional questions that we didn't get to. And thank you so much for attending, and we hope to see you on Monday for our next part 2 webinar. Thank you so much.